Yes, welcome to the chat. Today we want to talk about headaches. Welcome, Jamaican Uncle. I can see you here. We want to talk about headaches today. Headaches today. Headaches. Let's understand about headaches. Let's understand about headaches. Headaches. Welcome everyone. Today has been a busy day, but I've made it here. So as I prepare, we talk about very important thing that is called headaches. What are headaches? Because some people just talk about migraines. I'm having severe migraines, and migraines are types of headaches. So let's talk about headaches. We see what are headaches. As I prepare, I'm just preparing something here. As we talk about headaches, we see, where is this? Yes, that one. Welcome everyone. If you are new to the channel, please remember to subscribe. Please remember to subscribe to the channel, and also don't leave without hitting the like button. This is Benjamin the Wise Guy, bringing you medical talks and talking to you about mental health, medical talks, all of those that and if you have any question, you are free to post it so that the people that are in the chat, the professionals, can also help you to deal with it. It's an open this is an open platform where we talk about medical and mental health issues, medical and mental health issues. Now today we want to talk about specific thing that is called headaches. What are headaches? What are headaches? Headaches, a headache is a pain from sensitive structures in the head and neck. Sensitive structures in the head and neck. The brain tissue itself the brain does not give anyone headache. The brain does not give you headache. Pain comes from the structures such as the blood vessels and meninges. Meninges, the brain foldings and cranial nerves. Nerves, you remember the nerves of the brain, the nerves that come from the brain. How many? Dorothy is here. Welcome, Dorothy. We want to understand about headaches. We want to understand about headaches. We want to get to know what headaches are and how do they come. Because some people may say, I'm feeling pain here, someone here, the other one general. Let's understand what are headaches. And you have said headache is a pain arising from sensitive structures of the head and neck. Sensitive structures of the head and neck. The brain tissue itself does not give you headaches, but we have things like the meninges, the blood vessels that are in the brain. Blood vessels, you see these blood vessels, these ones, the blood vessels that are in the brain. And then we have something that is called the meninges, the cranial nerves in your brain, head, in the inside. There are 12 cranial nerves, and I usually call them: 1 olfactory, optic, oculomotor, trochlear, trigeminal, abducens, you see, facial, glossopharyngeal, vestibulocochlear, vagus, hypoglossal. All those accessory, all those are the cranial nerves that come from your head, and these cranial nerves can give you headaches. And the scalp tissue, Even inside the head here, down, there is a tissue that is called the scalp. The pathophysiology of headache. How does the headache come? Many people get headaches. Let me welcome Dorothy, Jamaican uncle. If you are here watching, and come to the chat, tell us where you are watching from, and like the chat. Don't just watch, like the video. And if you are new, tell us where you are watching from. Where you are watching from. Dorothy says, "Hello, doctor. Are you? How are you? I think today my head is foggy. My neck, I'm watching. Oh, okay. Thanks for watching. Let's learn, Dorothy. Let's learn. And if you are new, come to the chat. Text there. Tell us where you are watching from. And if you have anything that you can tell us or add on the topic, that is good. And let's interact. Let's get interaction. Likes, and subscriptions. They increase the capacity of social capacity. We'll be having a bigger family. So don't just swipe away. Don't just swipe away. What you do is you like and subscribe. Tell us in the chat if you are a new person in the channel, where you are watching from, and we will be happy. So, how does headache come? Headaches occur when sensitive structures are stimulated by inflammation. Sensitive structures like nerves, vascular changes, muscles, and blood vessels like this. Your brain has blood vessels like these ones. These ones. The circle of Willis is something that is a structure of blood vessels. Circle of Willis. So when those structures are irritated, and then they get inflammation. Inflammation, we say, maybe something happened, an infection, trauma, like you hit your head, and then inflammation occurs. You know what inflammation is? Inflammation ends up to get pain, redness, swelling, and so that the mediators of inflammation come, and oxygen and everything, the cells come there like the macrophage, and they remove the bad things, and then you heal. That is called inflammation. And inflammation, they can make the nerves be irritated. Your brain have nerves, and when those nerves are irritated, what happens? When those nerves are irritated, what happens is you start having headaches, nerve irritations, pressure to the you've hit your head, then the brain structure faces tension, pressure occurs, stretching, inflammation, all those. Now let's continue. Pain sensitive structures are scalp and skin. Under the skin there is a scalp. The skin itself is sensitive structure. Skull, periosteum. Under the skull, the periosteum itself, when it is damaged, you can have a very bad headache. Meninges, especially dura mater. There is white matter and gray matter. So inside your skin there is something that is white. If it is destroyed, and then it causes pressure to the nerves inside your brain, you start feeling pain and headaches. Efasi is here. Efasi, welcome to the chat. Welcome to the chat. Well, Efasi, I can see you. Always smiling lady. Always a smiling lady, and a lady who feels nice when she is socializing to other people. So if you are new to the channel, Benjamin the Wise Guy is the channel, and me, I'm Dr. Benjamin. Dr. Benjamin likes talking about medical issues to the public. To my friends like you who is watching, don't fail to subscribe, because when you are watching and you are feeling things are good, subscribe so that when I'm live, when I post something, you get a notification. When you feel this is a good channel, subscribe, my friend. If you are new, hit the like button. Now let's continue. Meninges, dura mater, gray matter are in the brain. Intercranial blood vessels, the ones that I've shown you. Those blood vessels, when they are irritated, you start feeling headaches. You see how headaches come. Cranial nerves, the 12 cranial nerves, or olfactory, optic, oculomotor, trochlear, trigeminal, facial, abducens, you see? Abducens, all those. hypoglossal accessory, glossopharyngeal accessory, vagus. All those are coming from your brain. And what do? They help you to innovate things like seeing, yourself, Ali. Is it in need of minerals? Have nothing to do with it or not? Is it in need of minerals? If you, I can't understand that. Maybe you are saying if someone have headaches, maybe this person doesn't have minerals. Joseph, please substantiate on that. Let me know what, like water. Yes, sometimes dehydration can cause headaches. Yes, you see, water and minerals are different things. Water is a universal solvent. That is dehydration yourself, and it can cause headache. It is important. So sinuses, a person with sinus problem. Sinus are the problem, sinusitis. Because here there are some nerves that come in the brain. What about salt? When you have low salt, let's talk about salt. Salt is a balance that helps you to have blood pressure balanced. So it can or it cannot. But let's continue and learn. Let's continue and learn. Muscles of the head and neck. These ones. You know, these blood vessels. You too, may God be with you all. Thanks, Joseph Ali, for being here. Hope yourself you have subscribed and you are part of us. This is not your first time to be here, but I know you have subscribed and liked the video too. So there are so many things that pass through your neck. There are so many things that pass through your neck and go down. So when they are irritated, sometimes you can find, you've seen people that have meningitis. People that have meningitis sometimes turning their head is hard because of inflammation of the nerves that pass through it is called knuckle rigidity. You cannot do this, you feel a lot of pain. So that is because of the nerves. And when you cannot move, you feel headache because nerves are helping the brain to innervate your body. Now, vascular mechanism. Vascular means the blood vessels, the arteries and veins of your brain and head. What also helped me is sitting in silence, also with no phone. Oh yes, sometimes when you sit alone, when you have headaches, the irritation goes down and the headache stops. So changes in blood vessels diameter can stimulate pain receptors. Blood vasculars. You know, blood vessels diameter means maybe your pressure goes so high and then the diameter reduces. So when the blood pressure is high, the diameter of blood vessels reduces. If it is big like this, it becomes, you also can focus on brain which activate neurons. Yes. So you see, when your blood pressure is normal, it becomes like bigger like this. But when it is low, Choya is here. When blood pressure is high, it becomes like this. So the irritation of the nerves with the blood vessels can cause migraine. Sometimes people have high blood pressure and it is called hypertensive headache. This is how it happens. If you have any question, please ask. And new people who are coming in the chat, if you have any question, please ask the question. If you have any question, please ask the question. Let's see you interacting. Dr. Ben, greetings to you. I'm fine, Choya. I see you are here. Qatar, right outer Qatar. Hope Qatar is doing fine. You're there at work. Always hustling, and hustling is a way of work, of life. So if you are new to the channel, don't fail to ask a question. Meet the people at the chat and let's talk about what you feel about any medical question, even if it is not about headaches. Oh, Queen is in the house. Queen, welcome. I see you. I know right now you are at work. I have like a disease symptoms. When I get up, I can be about to pass out or rarely pass out. Because check your sugar levels when you are waking up. yourself. Check your sugar levels when you are waking up, and your pressure too when you are waking up. It can give you guidance on why you're feeling that way. So Queen, welcome to the chat. Welcome to the chat. I'm honored to see you here. We are talking about headaches, and anyone who is watching and you are new, like and subscribe. When we are online, you get a notification that the medical crew is online. So if you have a question, the chat is open for everyone. Ask any question. Chad the chimp J, stay preyed upon because Lucifer, the taking suffering, racist children on earth. Chud, the chaplain J has texted something there. Let's see what Chud is saying. Hope Chud you have subscribed. Welcome to the chat, everyone who is watching. So the new people that are watching, why can't you subscribe to get notifications? Don't just swipe away. We need to grow. We need a social bank, a bigger. So like, subscribe, double tap your phone screen. Let's grow. Don't just watch and go away. Your subscription is important. It may giving you notifications when we are online. So everyone, welcome Chud, welcome Dorothy, welcome Queen, welcome everyone. Jamaican uncle is here. Yourself, what do I do when you wake up and you feel like that? Check your blood glucose. Go to the next clinic, hospital, or pharmacy. Tell them to check your blood glucose or blood pressure. It may be the problem that is yourself early. So welcome, my friends. Let's continue. Vascular mechanism, like high blood pressure, it may be the problem when it comes to. It may be the problem when it comes to headaches. Sometimes people that are hypertensive, they have headaches. The blood vessels dilation, activation of pain fibers in the brain because of the pressure. So when you give a lot of pressure in a blood vessels, it stretches. So when it stretches, like the blood vessels in the brain, the ones that are continuously like this one. So when they stretch, they irritate the nerves. They irritate the nerves, and the nerves do what? Make you start to feel headache. There is another way that someone can feel headache. As we continue, if my right is 11 centimeters higher than the left. Normally sometimes these things are not in a balance. I would advise you to see a doctor where you are to give the necessary test. But before you do that, check your blood pressures and glucose, mostly in the morning. Yourself, check your blood glucose and blood pressure mostly in the morning when you wake up. Now, inflammatory mechanism. Inflammation releases chemicals such as histamines, prostaglandins, bradykinin, cytokines. So histamine may cause irritation of the blood vessels. Prostaglandins are the ones. There is something called prostaglandins, and these are the things that cause inflammation. And inflammation comes with pain. So when your blood vessels in your head are dilating and releasing histamine, this is where you feel what? You feel headaches. Prostaglandin, anytime your prostaglandins are released in your system, if you hit yourself somewhere, you will have prostaglandin release. So those ones are the ones that shows you have. Doctor, did Chacharas contact you yet? He had a question. He told me contact. I've not seen any message from Chacharas, but I can check the email right now. Let me check, because I told Chacharas to email me, but I've not seen any. And many people have my number. I don't know why Chacharas don't have my number. The number that he hasn't communicated, Queen. He hasn't communicated. Yes, let's continue. I want to explain something. When you hit yourself somewhere like what happens is prostaglandins are released, and prostaglandins are the ones there are proteins or chemicals that make that place be red and you feel pain. So the blood vessels around that place dilate. Why? Because more blood should come at that area of injury, and when the area of injury has more blood vessels, what happens? Things like macrophages, the white blood cells, they come, more oxygen come there, white blood cells come there to remove all the dead cells, the dead, you understand, that is prostaglandins. And now when you have inflammation, maybe you have infections like meningitis, prostaglandins are released and the inflammation dilating the blood vessels make you to have problems, makes you to have problems of pain, because prostaglandins comes with pain. You see how people get headaches. This is general. We will go and talk about specific type of headaches. Let's talk about just the general first. The substances sensitive pain receptors, like people with sinusitis and meningitis. Doctor, my neck and back become stiff, and when I try to massage, it comes sound and small blood in my nose. Which place do you feel the pain mostly? The sound mostly at the thorax or below? Because that shows that you have to do something called rheumatic factor to check if you have arthritis. And the other thing is you have to do an MRI to see your spinal cord, how it is. It is very important, because when your back is producing some noise and blood is coming from your nose, it means the blood vessels around your nose are doing what? The blood vessels around your nose are injured. And when you feel the sound, it means the injury is coming from the movement of backbones. So have you ever done an MRI to check? Or are you arthritis positive, like rheumatic factor positive, or you do have any chronic disease we may entail bones? Those are things that are supposed to be cleared first. And the presence of blood from the nose shows that dilation of capillaries around there. You saw, we talked about nose bleeding. The small area, the palatine nerves, it is the pre-palatine nerves. You remember? Those are the things that we should check out. Those are the things that we should check out. Another thing is you may be injuring your vessels without knowing. It is very important to check the things that I have said. You may be injuring your body without knowing. Now, Dorothy, those are specific questions that I've asked you. Hope if they are private, you can email me. If they are, you can talk about them here. I explain, that is okay. So that I can help you more. Majay, welcome. Greetings, Dr. Ben and everyone. Welcome, Majay, to the chat. Welcome to the chat. Thank you for being here and being to this channel. Now, the substances that are sensitive in your brain are examples in meningitis and sinusitis. What is being injured is the nerves, the 12 cranial nerves. And the 12 cranial nerves innervate several things in your brain and body. And something like the 10th cranial nerve, which is the vagus nerve, comes from your brain, goes down even to the neck and comes down even to the stomach. So if it is injured, you will feel pain on your neck and head, and you will have a very bad headache. Now, sinusitis, olfactory nerve comes from here, the little area here, So people with sinusitis, they can feel a very bad headache because of the olfactory nerve. Inflammation goes to the brain. You see, that is why people feel headaches when they have flu. Inflammation of the nerves that arise from the brain. Increased intracranial pressure. Intracranial pressure is the space where the brain lies. So there is a fluid called intracranial ICF, intracranial fluid, that holds the brain and the spinal cord. So when the pressure of that fluid is increased, just like the pressure of the blood vessels is increased, what happens? Yes, the spinal cord is always becoming tired. I advise Dorothy you do an MRI to specify what is. But if MRIs are kind like expensive, you can start with a plain lumbar sacral X-ray, the plain X-ray, so that you can know if there is something that can be pushed to do an MRI, you do. But for now, you can do an X-ray to see. But you see, you waste money doing an X-ray, then you end up doing an MRI. It's better to just do an MRI, which is more clear and definitive than the others. Now, let's continue. If you are coming right now and you are a new person, hit the like button. Don't fail to subscribe. Let's create a more bigger society of good people that minds about health. Hit the like button and subscribe. Don't just watch and you have not subscribed. You need notifications when I'm live. When you have videos, you get notifications. So if you and you have not subscribed, check if you have subscribed and hit subscription. Do that subscription, there. And like the chat. Yes, because we are talking good things that help you to manage your life easy and manage your life in a better way. Now, increase intracranial pressure. The pressure that has the ICF, intracranial fluid. The work of the intracranial fluid is to hold the brain and the spinal cord, not to get tension. You see, if you just leave the brain in the skull, it will be hitting the skull every time and it can be damaged. So it is suspended. It is suspended on that fluid. It is called intracranial fluid. So if that fluid has high pressure, what happens? It presses the brain and the spinal cord. It presses the brain and the spinal cord. And if it is pressing the brain and the spinal cord, what can happen? The irritation of the nerves that arise from your head starts, and then you feel headaches. The space-occupying lesion of extracerebral fluid stretching manages. And what can make a person, the intracranial pressure to rise? What can make? Maybe brain tumor. A tumor, when it is growing in the brain, it occupies space. So it pushes the fluid and the brain. And then you have more pressure inside your brain. Hydrocephalus. What is hydrocephalus? Hydrocephalus is a lot of fluid in the brain. The intracranial fluid, the fluid that is holding, is a lot. You have seen some people that have gone with a big head that is coming because there was a lot of fluid and it pushed. You see, it is called hydro. Hydro is fluid. Cephalus is in the brain. So you people with hydrocephalus, they have continuous headaches because of a lot of fluid intracranial inside the cranium that is holding the brain. There is a balance between the fluid and the meninges and the pressure that the brain gets. Intracranial hemorrhage. These vessels that you see here, if one of it damages, yes, the spinal cord is always tired. If one of it damages, and when it damages, it starts bleeding from inside, maybe because of high blood pressure and the point of weakness bursts, and then you start bleeding from inside. What will happen? The intracranial pressure goes up, and then you start having problem. I'm just talking about things that can make you feel headaches. muscle tension, sustained contraction of the scalp and muscles of the neck, tension headache. They are called tension headache, stress-related headache. The muscles have tension, and then you start having headaches. I've talked about nerve irritation, compression of inflammation of nerves causing pain, like trigeminal neuralgia. Trigeminal. And you know trigeminal nerve, olfactory, optic, oculomotor, trochlear, trigeminal, the fifth cranial nerve. It comes from the brain, comes here, and then it divides into three. Mandibular, here is, and then it comes to optic. Trigeminal nerves, it divides into three. See, if you have a question, my friend, don't fail to ask. Let's ask the question. You see, so it comes and divides into three. From the brain, it comes here and then divides into three: maxillary, mandibular, and ophthalmic. So ophthalmic means it is in the area around the eye, here and here. So if you have a problem with cranial nerve number 5, your eyes have a problem, your jaw has a problem, headache can go through the whole face, especially here. You see, because of the ophthalmic nerve. You see, now those are situations whereby someone can get headaches, situations whereby a person can get headaches. Anyone with a question before we go to classifications, as I take my green tea? Green tea always. Anyone with a question? Nice, my people. Nice, my people. When we interact, I feel good. So for greetings, Doc, and everyone. Maje is here. Maje and Dorothy K is around and is saying some noise comes from the spinal cord. And I advise you do what? An MRI. It's good to do an MRI to clear all these issues. Sometimes you may be having an issue that is growing, and you yourself, you are kind of like ignoring the signs. So when it comes to be so bad, you say, I wish I knew I could do this thing earlier. You see, so my people, my friends, my people, let's talk about issues that are at hand. Headache. I can see there is no question. Let's talk about classification of headaches. Let's classify the headaches. How do we classify the headaches? Let's classify the headaches. We have primary headaches. Primary headaches just come. You don't have any problem. You don't have any nerves. You don't have any problem of your body. You don't have any problem. They are called primary headaches. But let's talk about something that is called another one, and a primary headache, tension type of headache. How does it come? It comes by stress and anxiety. Stress, muscle contraction of the scalp, increased pain and sensitivity. You see, watching from United States of Ngong. Welcome, Leila. I'm talking about headaches, and we are classifying now. And the classification I've said is we have started with primary headaches, tension type of headaches, tension types of headaches, stress and anxiety, muscle contraction of scalp and headache, muscle contraction of skull and headache, increased pain sensitivity. Most features are bilateral pain, both sides, you feel both sides of headache. Band like tightening, you feel like your head is being tightened. Mild to moderate intensity, not worsened by any activity. You just feel your head is tight, and it is, you see, tight. Those are tension type headaches. People that have tension type headaches, they have an irritation of the nerves, mostly the nerves of the brain, If you have any question about headaches, please don't fail to ask. Just ask any question about headaches and we talk. The coffee cakes, welcome. I can see you are taking coffee and I'm taking green tea. Taking coffee and I'm taking green tea. Thank you for coming inside. Leila from here, Kenya. Out our own United Nations at Ngong, United of Ngong, and then we have the coffee cakes. We have Margie from Jamaica, Dorothy, Queen, Yosef Ali, all Jamaican uncle always, and the new guys that have been here, Queen always, Chwea from Qatar, always big up. I'm taking tea and mandazi. Yes, good. I saw you are good in doing the mandazis. Big up every time. Now, let's talk about features of this. Most bilateral, you say you feel like both sides are tight, they are being tightened from inside, and it is not worsened by anything. Migraines. The one that people always say, I'm having migraines. People like saying, I'm having migraines. What are migraines? Activation of trigeminal neurovascular system leads to release of something that is called calcitonin gene-related peptide. Now, migraines come here. Trigeminal vascular system. Trigemina is a nerve. Is cranial nerve number 5. Trigemina. We have first olfactory, optic, oculomotor, trochlear, then trigemina. Trigemina arises from your brain and then comes here, and then it is divided into 3, like this. So this one is called ophthalmic, this one is called maxillary, and this one is called ophthalmic, maxillary, and mandibular. So it innervates like this, ophthalmic, optic, and mandibular. So when it is irritated, there is a chemical. Coffee cakes, what's your real name? When it is irritated, what happens? It releases something that is called CGRP. Margie, it was definitely something full of blessings. It releases something called CGRP, calcitonin gene-related peptide. When you have an infection, when you have trauma around this area, this mandibular, you see it has come from the brain and then it has divisions here. 1, 2, 3. So this place, mandible, ophthalmic area, and mandible. So when it comes there and you have maybe an infection somewhere here, they are like this, somewhere here or here, it releases CGRP, calcitonin gene-related peptide. So when it releases it, something else comes in. The big terms I can't cope. So you just know it releases some chemical called CGRP, calcitonin gene-related peptide. So that chemical is released by some others called substance P and neurokinin A. Those are 3 things are related. Then it irritates the whole face. Neurogenic inflammation, vasodilation, the one that we have talked, I have explained how pain comes when the blood vessel dilates. Neurogenic inflammation, pain, prostaglandins are released. Please, if you are watching it right now, start this from the beginning. You will understand how pain comes. Pain transmission. So listen, migraines is a very bad headache because the nerve that is associated covers your whole head like this. You see, This is trigeminal nerve. So when it is related, it irritates the whole head. Pain transmission. Features: unilateral, it can be one-sided. Because maybe the nerve is this side is related. Moderate to severe, it starts slowly and then becomes severe. Nausea, you can feel nausea because trigeminal nerve irritates the flow of food. Let me see. You see these things we are talking about yes. So you can feel nausea because part of my mandibular nerve is innervating the tongue and teeth, the jaw. You see, it is controlling areas around the mouth. You see, so you can feel nausea. That's why people with migraines, sometimes they feel headaches until they vomit because of this nerve that comes from the brain to here, then divides 3 times. It's called trigeminal nerve. Doctor, there were times when my head would pound at the temple and got better relief from bandana. You were tying a bandana on your head. If you tie a bandana, the pain comes down. You are having irritation of a tight bandana. Yes, a tight bandana because you are tying the ophthalmic nerve. So when you are tying the bandana here tightly, it is tying the ophthalmic nerve at this area, and these are these carotid arteries, and it is tying these carotid arteries, this one. So if you tie them, less prostaglandins goes at the nerves, and you know the prostaglandins are the ones which cause pain. So if you tie it, less blood flow and less prostaglandin, so less pain. It is called CGRP, calcitonin gene-related peptide. That is what makes people feel pain when they have migraine. CGRP, when they have headaches. So features are unilateral, throbbing or pulsing, moderate to severe, nausea and vomiting because the area of the mandible, the branch that comes to your mouth, and sensitive to light and sound because you know they are free. Any irritation to a nerve, it will irritate where it's innervating. So if it is coming the ophthalmic, it comes to the eye, maxillary comes to here, to the skin, and then the mandible comes to the mouth, the tongue. So you may be, when you have migraines, you may be sensitive to light because of the nerve that is coming to. You see, yes, because when it gets bad, I've been told by other doctors that the digestive doesn't work well with. So I had injections. If pain went past the pill, yes, sometimes pills do not work because when you give pills, before they get to the stomach, we say it's it's digested. So you absorb less. The bioavailability is low to the bloodstream. But when you inject, more bioavailability is high because it goes direct to the blood vessels. Anyone with any pain? With any anyone with any question? Sorry, with any question? Anyone with any question? If you are new to the channel, you know what to do, my friends. Hit the like button and subscribe. Don't go without subscriptions, man. It's good to subscribe. It makes someone feel better. Now, types of migraines. Migraine with aura, most common. Migraine without aura. So, migraine with aura, neurologic syndrome, persist headaches. You see flashlights, zigzag lines, blind spots, and tinkling sensation. Because it is past. The nerves are there. The nerves are done what? Are being irritated. They are involved. Yes? So you can like see zigzag lines, you can like see blind spot, tingling sensation, and flashlights. There are two types of migraines. We have said migraines with aura and migraines without aura. So aura means you see some things like flashlights, blind spots, tingling sensation, sometimes blackout that come and go. Those are auras. You see. So that is a type of headache, migraine. We started by primary headaches and then we went to migraine headaches. And before we went to classifying these headaches, what have we done? I've started by explaining how the headaches occur. Physiology, how the blood vessels in your brain make you to have the headaches. Inflammation of the nerves, the meninges, the vascular layers, the dura mater, I've explained, the prostaglandin release, CGRP, calcitonin, gene-related peptides in explained. Welcome to the stream. Please, if you haven't yet, double tap the screen. Thanks, Coffee Cakes. You see, so it's good when you are coming in and you are not understanding something, ask. But you can start this video from the beginning for you to catch up on things, you see. So, migraine with aura is that cluster headaches. We have something, cluster headaches. C, classification. We have primary migraines and cluster headaches. Cluster headaches. Now, cluster headaches are hypothalamic dysfunction, Solo family adventure. Solo family. Hello, my friend. Solo family adventure. Is this the first time you're here? Welcome to the chat. Hit the like button and subscribe also if it's the first time. My kid always comes home with headache and painkiller. She is better. Is that something to worry? If your kid comes out home with headaches and you give painkillers and it is better, don't continue giving painkillers. Give that kid fluids. Give the child like 20 to 30 minutes, the headache go. Don't always give your children painkillers after school because it means dehydration, workout, use tension, you see. So Salo family watching from Canada, thanks for watching. Big up all the time. Hope you have subscribed to this channel, this amazing channel with amazing people that are talking about these things at the chat. Big up all the time, my friends. Big up all the time, Jamaican uncle where you are, Coffee Cakes and Layla in the house all the time. Big up all of you. And Majay from Jamaica, yourself, Ali, Queen, and everyone that is tuning in and listening to me as we talk about headaches. That is a top. Thanks for watching. Yes, dehydration is usually the culprit. Yeah. So don't always give your children, don't treat the symptom, deal with the situation. If a child comes here home with headaches always and you give paracetamol and it goes away, just know this child is suffering from dehydration or tension after school. Give some fluids, don't let the child always after home. The first thing is go and take a bath. Take a bath faster, do your homework. No. Let the child come home, let the child rest, take a bath. You can tell the child to sleep for 30 minutes or 1 hour, take some fluids, and then wake up, do assignments. It's better because the child has just come from school where he's been having more of classes, dehydration, playing at school, and then at home again. He's at home. The first thing you do, start your homework. The tension is still there. The child has a headache. Not good. Give the child a break. Let the child sleep for 30 minutes, wake up, watch some cartoon for 1 hour. Then tell the child to go and do homework, which is a better thing for the child to relax and break the monotony of school. Even in boarding schools, I've seen after 4, children are forced to go to the field and play, then come take a bath, then take supper. You see, so pathophysiology of cluster headache is the same: trigeminal activation, hypothalamic. Boss, can I have a blue, please? Yes, you will be given. No worries, you will be given. You will be given. There is someone who will give you a blue right now, because you see, I'm kind like giving some topics, but don't worry, stay around. You will be given. You will be given. Salo family, is this the first time in this chat or what? Have I seen you? And big up. Thanks for you tuning in. Now, features: severe unilateral orbital pain. Orbital is the eye. It lasts for 15 to 180 minutes. Thanks, Salo family. Salo family, if you have a channel, post your link there. People can come and watch you and be a bigger family. Post your link there. People can follow and see you and see what you are doing. For now, let's continue. Hope Salo family, you have subscribed. Yeah, yes. Occurs in cluster over weeks. That is cluster headaches. 15 to 180 minutes. That is 60. That is 3 hours. 3 hours. You have a cluster headaches. Sometimes you feel like you are crying, your eyes are red, and nasal congestion, running nose. The what is happening? The trigeminal nerve is injured. You see, patients are usually unable to sit still because of this headache. There is this condition, water in the brain, called hydrocephalus. Maybe one day we should talk about it, because it really misunderstood. Yes, hydrocephalus, I've talked about, when I started, I've talked about hydrocephalus and headache, and those are they are genetic bone problems, and we will talk about it. Thanks for reminding me. Maybe if I come at 10 today, I'll talk about it. I'll talk about it. Sorry, I'm getting ready to meet someone, so I'm back and forth with you, but I'm still in the background. Thanks, Jamaican uncle. I'm live as well. Thank you. I'm live as well. Thank you for being on that side of the camera. Blessings, everyone. Tipping people on the side of camera. It's not easy. Very simple to be mean. It comments. Try dealing with YouTube. How to spell Mark? Have you subscribed to my channel? Yeah, how to spell Mark? How to spell Mark is saying, I am live as well. Thank you for being on that side of camera. Blessings, everyone. Tipping people on the sides of camera. It's not easy. Very simple to be mean in comments. Try dealing with YouTube. I've not understood that correctly, but thanks for your comment. So let's continue, my friends. Let's continue as we go to secondary headaches. Anyone who has not understood migraines and cluster headaches and migraines, primary headaches and cluster headaches, please ask a question. Even me, I'll be leaving you here to play dog. I need to go and get our supper. Yes, it is 5:33, and I know when children are please, the child Leila, if your child is there listening, let her come. You ask the questions. You be the teacher now. What have you learned? What can you do to avoid headaches? Let her be on this screen and watch and listen how we can we can cope with headaches. Thank you for being there, Leila, and thank you for telling the children to watch good content like this ones and help people to know how to live healthy. Good one. Jamaican uncle still here, bigging up coffee cakes. When I get new prescriptions for my eye, I get headaches. Till I get used to new script. Okay, because of irritation of optic nerve and ophthalmic nerve. And ophthalmic nerve is the branch of trigeminal nerve. And trigeminal irritation causes headaches. So when you get a new prescription, what happens? Coffee cakes. The trigeminal nerve is irritated. Before it comes to get used to the drops, you get headaches because of trigeminal irritation. Ophthalmic, ophthalmic, maxillary, and mandible. Okay. She said today they were playing basketball and it was tiresome because boys kept pulling and pushing. Oh yeah, sports can also be a cause of headaches. Dehydration, being pushed, hitting your head. And you know when you're hitting your head these sides. These sides we have several specific nerves. The trigeminal nerve and the artery that is called the carotid arteries being pushed every time, and then you feel headaches and pain. So let's go to secondary headaches, my friends. Secondary headaches. What are secondary headaches? Can caused by underlying disease. Sinus headaches, sinusitis, inflammation of the sinus. My friend, there is no disease that is called sinus. No, nothing. Sinus is a simple way of saying holes. A medical term to say these are holes. That is sinus. So the inflammation in a sinus, in a hole of the nose, this is a sinus, it's a hole of the nose. Around the hole of the nose, there is a cartilage. Soft cartilage. So inflammation of the soft cartilage there and the lining of the nose is what is called sinusitis. So there is no disease called, or there is no complication called sinus. No. We only have sinusitis, inflammation of the area around the nose. Yes, just like ulcers, which means wounds. So these things are not complicated. I went to a doctor and doctor said I'm suffering from sinus. You have sinus, everyone has sinus. I have sinus, Leila has sinus, Coffee Cake has sinus, Salo family, Jamaican uncle. But the problem is when the lining of the nose is getting inflammation or sensitive to allergens like dust, perfumes, and then they swell inflammation, you see, or infection like a flu, that is when you have sinusitis or chronic inflammation of the areas around the nose. Sinusitis. So sinus inflammation and blockage of paranasal sinuses, the blockage of these two walls. Facial pain, forehead pain, here forehead pain, nasal discharge, and worsen when bending because trigeminal nerve and facial nerve and olfactory nerve. Olfactory nerve comes from the nose here and it's the first here. So you will get more headache here. People that have sinusitis, inflammation of the nasal area, the headaches mostly are here because of the olfactory nerve. It is being irritated. The nerve is being irritated. Remember, this is just a drive-through, and the drive-through headache is a very wide topic. I'm going through, and then we will go back and start having one by one. Primary headaches, we go. Migraines, we do it. So today we are just doing an overall thing, So don't worry, this week it's a Monday here, and we are feeling good to be on a Monday, and we will continue having a good. You see, yes, dog must smell most smell irritate me. Yes, and then you start. You see, when you smell something like strong perfume, and then you sneeze, achoo. It's coming from the nose and it will irritate the nasal area. Yes, so it means Marge is hypersensitive around the nasal area. Marge, it means you are hypersensitive around the nasal area. So I know maybe in your house you don't use perfume, but when you go out and then people start using perfumes, you get really irritated, sneezing every time and trying to use masks every time. And more sneezing causes headaches because the olfactory nerve number 1, cranial nerve. When I'm saying cranial nerve, I'm saying nerves of the brain is irritated. Photophobia, neck stiffness, all those are coming to meningitis. Meningitis only means inflammation of the meninges of the brain. Inflammation of meninges of the brain. And when your meninges of the brain are in perfume especially, you see, imagine you are hypersensitive. So it means you stay away from a strong smell and dust. See, stay away from strong smell and dust. So severe headaches, fever, neck stiffness, photophobia, all those features of meningitis. And why do people with meningitis have headaches? Because the nerves that come and the vessels here are inflamed. So you cannot turn your head like this. You are feeling so much pain. You see, we call it in medical narcotic rigidity. Even the neighbor's perfume in the morning. Wow, you see hypersensitivity. Now, let's continue. If you have something to tell us, something you can say, please come. Marcia Thompson, hello Benjamin, good morning. I'm here having headaches from last night. Where are the headaches? Today we are talking about headaches, Marcia Thompson, and I know you are understanding how your headaches are coming. I know you understand, and your headaches, we have discussed something about tension headache, and we have discussed something what was this increased intracranial pressure. So Marge, you need to have drugs like diuretics and some painkillers, and stop watching a lot bright light. When you are watching TV, make it be blood, not full light. Make it be blood, and you will feel better. Hello Benjamin, I'm from Light. I'm feeling headache. You get furosemide and paracetamol. It will relieve your headache, because if you take paracetamol alone with your kind of headache, it will not. You will feel better in 2 minutes, 2 hours, and then the headache comes back. You need some diuretics. Mostly potassium sparing are good. I like potassium sparing. Potassium sparings are like spironolactone. Yes, or watch TV with sunglasses. That is an idea too. Greetings, Marcia Thompson. Sorry to hear about your headache. That is from Marjorie. So that is it. The Coffee Cakes is advising you to watch TV with sunglasses. And also use some diuretics when the headache is too much. When the headache is too much, we use some diuretics like spironolactone. It will help. That one, I'm sure for you it will help. But if you use only painkillers, it will not help fully. You will feel better for 2 hours and then the headaches come back. Severe elevated blood pressure causes vascular stretching. So when the blood pressure is so high, the walls of your blood vessels, they stretch, and when they stretch, what do? When they stretch, what they do, your blood vessels release some prostaglandins. You start feeling occipital headache around them, worsening in the morning, associated with very high BPs. Doctor, what causes the headache during or before menses? Hypovolemic shock. Hypovolemic shock. Some people have heavy menses and they lose a lot of blood. So compensation mechanism, because the blood pressure goes down and then it starts to go up. That is called hypovolemic shock. You start having headaches. And the compensation comes with prostaglandin release, cytokine releases, and then you start having irritation of your nerves, and then the headaches come. You see, so if you are a person who is having problems of headaches after menses, you better, when you are in menses, you take more fluids, and fluids that have sodium and electrolytes. It's very important. So Marcia Thompson, I hope you have understood my point on using of diuretics for you. Now, severe elevated blood pressure causes, that one I've said, stretching of the blood vessels, and then when the blood vessels are stretched, what happens? Start having headaches because of release of some things. When your blood vessels are stretched, prostaglandins are released, several things are released. Tumors increase intracranial pressure. Tumors, your brain is balanced by the fluid, intracranial fluid, ICF, that is within the brain. So when you have something that is growing inside, it can starts to cause pressure, and thus tumors grow and they cause pressure inside your brain. So when they cause tumors inside your brain, what happens? You start having problems with headaches. Brain tumors and headaches. They start progressive because it is growing it is growing slowly by slowly. It is growing progressively. It is causing pressure. So when your headaches are starting to be mild and they are going as increasing with time, you have to do a brain MRI to check if you have a tumor. It starts from slow and growing progressively, and they are worsened in the morning. And mostly the trigeminal interaction is here. They irritate the trigeminal nerve, and so you start having vomiting and some problems in doing some things at times. So if you have a friend or you or your relative or anyone that you are close to started to have some problems that is mild, and then the headache started to be worse with time, please advise this person to go and do something that is called a brain MRI. Why? Because it shows something is growing gradually inside the brain, causing irritation. Doctor, those with hysterectomy or menopause, so no blood loss, what could be the cause? A person with hysterectomy or menopause does not go menses, does not have menses. So the cause may be secondary, migraine, secondary to irritation of the trigeminal nerve, secondary to something else like sinusitis, secondary to pressures of life, depression, thinking a lot. People that are at menopause, so it's not hormones. Hormones can cause you to have it, because when you have depression, you kind like don't release serotonin. You don't release dopa. And when you don't release dopa, what happens? The balance in the brain becomes a problem. You start having nerve irritation. Some things, cytokines like prostaglandins, get released. So when they are released, you start having headaches. So hormones are introduced, are there. For a woman to have a normal menstruation, you remember, let's get to remember the normal menstruation cycle, whereby follicle stimulating hormone is released. And then follicle stimulating hormone activates the pituitary gland, and to release luteinizing hormone, there is gonadotrophin releasing hormone that stimulates the release of luteinizing hormone and follicle stimulating hormone. Luteinizing hormone takes control of something that is called the luteum, corpus luteum, that produces progesterone that takes care of the pregnancy. Follicle stimulating hormone stimulates the follicles to release estrogen. You see? So if this balance is not there, and you have not got conception, so the corpus luteum breaks down and it comes out, so you start menstruating. If you have not indulged in anything and there is no conception, so corpus luteum breaks, progesterone down, and then the wall of your uterus, because it is not producing anything, there is no products of conception. If corpus luteum breaks, it goes, your walls become weak and thin, you start menstruating. Then the estrogen goes up. So when follicle stimulating hormone is activated, the egg comes. So in menopause, these hormones are not produced as needed. You see, the follicles are thinning down, estrogen is low. Even when the follicle stimulating hormone and gonadotropin releasing hormone is doing, there is not enough estrogen. So the imbalance of these hormones makes you to have irritation of some nerves from the brain, and then you start having headaches and burning sensations. Menopause, it is called, the burning sensation is called neuropathy of the nerves. You see, let's learn, my guys, and appreciate this learning by talking, interacting, telling someone thanks for being in this channel, as Benjamin the Wise Guy is talking to us about good things and how to avoid bad things. So tumors increase intracranial pressure, progressive headache, worsens in burning, vomiting, and neurologic deficit. Let's talk about subarachnoid hemorrhage. Bleeding in the subarachnoid space causes meningeal irritation. Inside, hemorrhage. These vessels, like and subscribe to Dr. Thanks. You see these are your blood vessels of the brain. These ones are your blood vessels of the brain. So when they bleed inside the brain. And bleeding inside the brain, it causes severe headaches because of pressure inside, and neck stiffness because of nerve irritations, and then loss of consciousness because of hypovolemia and problems that are involved in this. You see how things happen. If one of your vessels, the ones that I've seen, breaks and starts to bleed, it is an emergency. That one you need to go faster. Within 6 hours you are in theater. We do something that is called a borehole. We remove the clot and we stop the bleeding, because more pressure in your brain can lead to stroke or death of some of your brain, and death of part of your brain means no innervation. If it is the area that innervates seeing, you will not see. If the area that innervates walking, you will not walk. Now, there is something that is called temporal arteritis, not arthritis, arteries, temporal arteritis. These arteries these ones are called the temporal lobes of your brain. These sides are called the temporal lobes. So the temporal lobes are these arteries here. These ones are these ones. They are called carotid arteries. Carotid arteries. This one. These carotid arteries. The temporal lobes of your brain. They are called. So temporal arteritis, inflammation of these arteries that are coming here, they are called the carotid arteries. When they are getting inflammation, you get headaches. Because I've said blood vessels, when they are undergoing inflammation, they release some things like prostaglandins, CGRP that Leila was saying. It's a tough medical term. You see, they release those things, and then you start having that. We call them mediators of inflammation. Calcitonin gene-related peptide. So when these arteries, they are going, and you start having headaches, and mostly these things happen in elderly patients, temporal pains, jaw pain while chewing, and visual disturbances because of the trigeminal nerve. See, because of the trigeminal nerve. Very important when we are learning these things, Post-traumatic headaches. Trauma, hitting your head somewhere. If you hit your head somewhere, mostly this side, and I've said this, and I want to tell your parents, stop slapping your children in the head. Parents, there are so many ways of disciplining your children, and the most bad thing you can do to your child is slapping your child in the. Some parents like slapping. When a child has done something, they slap that child on the head. Very bad. Stop slapping your children at the temporal areas. You will make this child to start having chronic pain as he grows up or he grows up. And you are the one who will be taking this child to hospitals every time, while you are the one who has started the problem. So head injury causes inflammation and tissue damage. Follows trauma, may be associated with dizziness and memory losses. It's okay to slap Habito, yes? Hey, coffee cakes. The child no, but your hubby you slap. No, no slapping. No slapping. Slapping is not a good thing. Head injuries are associated with this. Now, as we go on asking questions and interacting and being here for Benjamin the wise guy, slap. The coffee cakes wants me to say yes, but I'm adamant. Coffee cakes, I won't say yes. No, I don't like havocs and chaos. So let's give a recap, because all those things that I've said, from tomorrow we are starting to deal with them one on one. This is just a recap. Imagine more than 1 hour of going through everything. So headaches is a big topic, a very big topic, and that's why I've gone through everything before we start, so that anyone can see this video and go through the video and say, oh, I heard about that in the first video. So slapping is not good at the temporal areas. It's not good. You may slap someone and then you end up you yourself every time in hospital, because you are the one who started the problem. So let's talk about types of headaches. In summary, I've said tension, migraine, cluster, sinus, meningitis, hypertension, brain tumors, subarachnoid, and temporal arteritis. I repeat again, my friends, listen: tension, migraine, cluster, sinus, meningitis, hypertension, rebound. Yes, that one, rebound, is characteristic. When we are starting tomorrow on some types, the ones that I'm naming, you will see rebound. There are several: rebound, tension, non-rebound. You will see them. I have terrible migraines. Marcia Thompson, go get furosemide for now. 1 tablet, they will relieve your headache. Furosemide 40 milligrams. Furosemide 40 milligrams with paracetamol 1 gram, 2 tablets. You will be okay. Now, let me repeat the types of things that I've gone through: tension, migraine, cluster, sinus, meningitis, hypertension, brain tumors, subarachnoid, hemorrhage, and temporal arteritis. Tension is muscle tension, band-like headache, a headache that you feel it's, you see. Migraine, trigeminal vascular activation, the nerve, trigeminal nerve, throbbing and nausea and vomiting. Cluster, hypothalamic dysfunction, severe eye pain. Sinus, inflammation of the sinus causing pain, facial pain. Meningitis, meningeal inflammation, fever, neck stiffness. Hypertension, vascular stretching, and occipital headache. Brain tumor, increased intracranial pressure. Brain tumor is increased intracranial pressure. So here you need some diuretics, and talk to your doctor on some drugs that can delay the growth of the tumor or remove it. Morning headache, subarachnoid hemorrhage. You see, morning headaches. When you start having morning headaches, always think about a tumor in your brain. So before you sleep, furosemide and some osmo diuretics. Subarachnoid hemorrhage, intracranial bleeding, certain severe headache, and temporal arteritis, the one that we have talked about the last. Arterial inflammation, temporal pain, and vision loss. So there are some red flags that you may have when it comes to headaches. Red flags that you may have when it comes to headaches. What are these red flags? These red flags are sudden thunderclap headache. That's why almost every morning I have headaches, doctor. It's because of the tumor. Yes, it's because of it. So I advise you to be having some diuretics in the morning before you wake up. To 1 hour before, you can take a diuretic to release the pressure. You see, to release the pressure. New headache after age of 30 or 50. Headaches that are coming at 50s. Fever and neck stiffness, that may be sign of knuckle rigidity, and it may be telling you have meningitis. Loss of consciousness after a headache. Vision loss. Headache after progressive worsening headache. cancer or HIV patients with new headache, because new immunosuppression is equal to infections. So cancer and HIV patients, their immune system is down. You may have, so those are the red flags that may occur. Sudden thunderclap, new headache after 50 years, fever and neck stiffness, weakness and paralysis of one side. Weakness and paralysis of one side, loss of consciousness, visual loss, headache after trauma, progressive worsening headaches, and cancer and HIV patients. So that is an overview. Just imagine that is an overview of headaches that I've gone through. An overview of headaches that I've gone through. Imagine, my friend. So headaches is a headaches is a big topic that this whole of this week we will be dealing with headaches step by step. So my friends who are watching everywhere, everyone who is here watching, everyone who is here watching, you see, we all have headaches, and headaches have been a big situation in our life. Even right now, you can see Marcia Thompson is complaining about headaches. So Marcia, please get a diuretic. Get a diuretic, be it spironolactone or furosemide. Please send to a pharmacy, get it. Take one. If it is furosemide, get 40 milligrams. If it is spironolactone, take 25 milligrams with 2 paracetamols. Get your headache done. Anyone with any question? I was reading something here. Anyone with any question, my friends? Any good question, any medical question, anything to anything to make us smile. Let's smile a bit. We usually talk about diseases. We usually talk about diseases so bad. We usually talk about diseases. Let's smile. Who can make me smile today? Hey, so that is a recap, just an overview of headaches. Imagine, my friends, an overview of headaches. We haven't started digging in about headaches. We haven't started digging in. And you have seen Coffee Cake saying rebound tension, headache, tension, and rebound, all those. So anyone who has a question, and guys, which topic do you want? FRC told me to work on something that is called hydrocephalus. Let me write it down. Hydrocephalus. What is hydrocephalus? Which other topic do you want me to talk about? Any other topic that you want me to talk about? Any other topic, my friends? Any other topic that you want me to talk about? Please tell me that we know. The first FRC has told me we talk about hydrocephalus. A lot of fluids in the head. I will talk about it. Anyone else who has a topic of interest? A topic of interest is a topic that you really want to discuss and know what is happening. Even any topic that we have gone through, because this week we are talking about headaches. This week is a week of headaches. The week of headaches. Any question? Any question, my G's? Let me say my G's. Any question, my G's? Who has any question, my big G's, my friends? Efasi has told me, Doc, talk about hydrocephalus. I'll talk about it. So headaches is a big topic. Headaches is not just a topic, because every person, some people just say we have headaches, and they mistake headaches with thank you for those likes, man. Thank you for those big likes. Many likes. I can see many likes there. Welcome. The one who is giving more likes, may you be blessed. May you be blessed where you are. Yes. Thank you for those likes. So, any topic that of interest that anyone has before I leave. I know my time is here, and I'm giving bonus. Anyone with any topic of interest, give me the topic. I schedule it. Give me that topic. I schedule it, so that we can talk about the topic of your interest. And what you have learned. It's good to listen and learn. As much as we are coming to socialize on this platform, as much as we are coming to talk and interact, please learn something. Please learn something, because sometimes you find yourself in a situation whereby you found yourself in a situation that you have a person who needs dire help, but you can remember something. Dr. Ben said something. But you can really not remember the first aid. And so it's good to learn something. You will save a life somewhere. You will save a life with these topics that we are learning here. My friends, these topics, we come here and talk and laugh and interact. You can save a life just by listening and going through slowly and internalizing and remembering. One day you are in a crowd of people, someone collapses, is conversing, you do the right thing, and that person, you save a life of that person. Just imagine. So don't just interact. Don't interact, just interact. Let's learn something. Let's get to understand the concepts of medicine, the concepts of some diseases, how to handle some diseases. Let's help someone somewhere one day. You get? So no one wants me to talk about a topic that of interest. Any topic of interest that someone feels like. No one? Give me a topic of interest, my G's. Give me a topic of interest. I talk about it, Topic of interest. So, yes, I can see the time has dropped. Right now it is 6:11 Kenyan time. I know it is around 9 in Jamaica and Georgia. Around 9 in the morning. You guys, 9 or 10, around there, 9 or 10. If you are in a region that is morning hours, be blessed. If you are in a region that is evening, big up every time. Yes, it's 10:11. Good. Big up every time. I can come at 10 today to go through some, like I've been told to talk about hydrocephalus. I can come to talk about it a bit, and we learn more about medical issues. So you guys, my guy, Iska Skin today has come late. Iska Skin, you will rewatch. Give me your like, Iska Skin. Give me your like as I go. As I go to do some other work before I prepare for 10 p.m. at night, before I prepare for 10 p.m. So guys, anyone with any question before I sign out? I have one request. Hydrocephalus, this one. I have that request to do hydrocephalus. So I'll see if I can do hydrocephalus. Hydrocephalus excessive accumulation of water in the brain. I'm going to get some rest now. The phone light is affecting my headaches. Bye bye, Marcia. Don't worry, just do what I've told you and you'll get better. So I can talk about it at night as I get some questions. Thank you for sharing your either. How about teeny slap on the cheek? No slaps, no slaps, no slaps. No slaps, no slaps, no slaps. Give wisdom. Give wisdom, no slap, no slap, no slap, no slap. So you guys, if you have come late, rewatch this. Bye bye. See you guys. Bye.